With more and more people travelling within the EU, what happens if a European citizen needs healthcare in another member state? And especially, what about the cost? The European Health Insurance Card covers the costs if you fall ill during a trip to another EU country. Costs are also covered for patients who've been authorised by their national health system to go to another member state for medical treatment. But what happens if the authorisation is not granted? Let's consider the case of Yvonne Watts. This resident of Bedford suffered from arthritis in both hips. She would have had to wait a year for an operation in the United Kingdom. Racked by unbearable pain, she could wait no longer. Despite the refusal of her health authorities, she travelled to France, where her operation could be provided sooner. When she returned, her claim for reimbursement of her medical expenses was refused. After several appeals in British courts, her case went to the Court of Justice of the European Communities, which decided in favour of free circulation, reflecting the principle of patient mobility.
The Court, Grand Chamber hereby rules.
Following this jurisprudence, the European Commission is acting to clarify the right of European citizens to cross-border healthcare.
Patients want to have healthcare as close to home and as quickly as possible. But sometimes the best way to provide that healthcare may be in another member state. It may be that you live in a border region where the nearest hospital is just across the border in another country. Or it may be that the care that you need is so specialized that actually it's not available in your own member state and needs to be provided elsewhere. The aim of this initiative is to make it easier for patients to have the healthcare that they need wherever it can best be provided within the European Union.
Another example illustrates the issues from free movement in the health sector. Nicholas Decker, who lives in Luxembourg, needed a new pair of eyeglasses. He took the prescription he received from his Luxembourg practitioner and went to Arlon in Belgium to purchase his glasses from a Belgian optician.
J'ai ensuite envoyé cette facture.
Then I sent the bill to my medical insurance company in Luxembourg, which, to my great astonishment, refused to pay. They justified their refusal, stating that I should have requested prior authorization. Now, in my mind, this constitutes a barrier to the free movement of goods throughout the Union. Thus, in 1992, I launched a long series of legal proceedings. And the case was finally judged by the European Court of Justice, which, by an order in April 1998, decided in my favor. The principle is thus acquired, but do all European citizens have this right?
The question, though, is exactly how can those rights be used in practice? At the moment, there is a lot of uncertainty for patients, for health professionals, and for people who are responsible for health systems about what community law means for cross-border provision of health services. This initiative is intended to address that uncertainty and to provide a clear framework for patients to be able to have access to healthcare in other member states, and for member states themselves to be able to regulate and plan their systems effectively.
The principle of patient mobility is crucial in the case of patients suffering from rare diseases. Ansel Schlupt lives in Nancy in France. He suffers from Gorham disease. This vascular disorder hinders bone mineralization and can lead to paraplegia. After considerable research, the family consulted American specialists who defined a treatment protocol. There was a problem, however. The American treatment is not authorized in France.
The American treatment consists of two medications. One must be taken every day. And in France, this treatment is not authorized on a daily basis in the dosage that the American doctors prescribed.
Monique Schlup thus looked elsewhere in Europe and found a solution in Spain. In Madrid, Dr. Lopez accepted to take Hansel's case and to apply the protocol defined by the American specialists.
En la actualidad, Hansel lleva ya más de
Hansel has been treated for the past 8 months with this American protocol based on anti-anxiety drugs intended to slow down lymphatic proliferation in the bones. We hope this protocol will improve over time, that the disease will go into regression, and that we may even be able to envisage reconstructive surgery, especially to the spine, which is Hansel's most seriously damaged organ. In the case of Gorham disease, like other rare diseases, why is it so hard to find treatment closer to home? There are many factors involved. The first is that it's hard to find a doctor with experience in this disease. In fact, there aren't many, even all over Europe. Then you need to find a doctor willing to take on a chronic patient requiring a lot of care and who is backed by a multidisciplinary team of specialists. Just one doctor alone can't manage.
As healthcare becomes more specialized and more expensive, it can be difficult for every member state to afford to have every type of specialized care. By making it easier for systems to cooperate with each other, we can help all health systems to provide better care to their citizens at more efficient use of resources.
But what about the costs of this treatment? In principle, the French Social Security should be able to take on the cost of treatment in Spain.
The American protocol is a fairly costly treatment, and our problem was that the Social Security in France didn't want to bear the costs of the treatment, considering that in the long term this treatment could have been given in France.
But for this type of disease, it's the short term that counts. When Dr. Lopez agreed to treat Hansel, the decision was swift. Hansel changed countries and moved in with his sister, who lives and works in Barcelona. The Spanish Social Security could thus cover part of the treatment.
The issue is that they sometimes find it difficult to then have the reimbursement for that healthcare that they're entitled to. This initiative will aim to provide additional clarity to make it clearer for patients as to what healthcare they're entitled to and how they can be reimbursed for it, and clearer also for health system managers who need to plan and regulate their own systems to be able to provide healthcare not just to patients who move, but patients who stay within their own member state.
The Charter of Fundamental Rights of the European Union includes the right to healthcare for all. However, it's up to member states to decide how to implement this in practice. This initiative respects that responsibility of the member states and is not intended to harmonize healthcare systems. It will also complement the existing coordination of national healthcare systems. Rather, the objective of European action is to help ensure that all European patients have access to safe, high-quality healthcare within a reasonable time, and that they know how the costs of that care will be covered.